when Governor Napolitano left and Brewer came in, she asked me to be the director of the state health department, and I said I'd do it. And a couple of months later, she asked me to be on the Developmental Disability Planning Council. 2009 and 10 were really all about getting the council up and running and getting the resources in place, finding an executive director, and then putting forward a strategic plan for what we wanted to accomplish.
The transition was extremely exciting and difficult at the same time.
I had met with an executive director that I had previously worked with, and she approached me with the idea of, you would be really good as a contracts manager because this is a council that oversees federal dollars. And so I started a week before Thanksgiving, not realizing all that was coming down the pipe within the first, I would say, 90 days. And I had to really work hard for the next 3-4 months to get things under control because it was all hands on deck. We had so much to do, and it was pretty nuts at that time.
My first council meeting was impressive. It was a full council meeting, impressive in the fact that there were a lot of power hitters in the room. There were the heads of a lot of agencies, and it hit me that there were a lot of people in there that could be really influential for policy and for good.
So when I started as the executive director at ADDPC, Larry Clausen, the previous director, shared with me some important advice. He said, I'm not sure how this administration is going to view councils on developmental disabilities. So that's when we got the budget for the next year, and all the councils had been eliminated from the budget. Okay, totally eliminated across the country. We were being reorganized. And I remember that those first few months, I had to do a mad dash, meet every single congressional member's office, tell them who we were, what we do, here's some of the things that, this is why we're important. And I had to have that conversation, but the reality is that crisis was an opportunity for us to meet our congressional delegation that we haven't met before. About a third of our council are self-advocates. I actually have cerebral palsy myself. So when we share stories about how, about things that we learned, about barriers we've encountered in our community with other community members to help and tell them how, what can help overcome those barriers. And that way, we actually can make system change.
What we like to do is provide empowerment and teach people with disabilities how to advocate for themselves. We're really big on what's known as the self-advocacy movement. It's the idea that people with disabilities are able to advocate for themselves, speak up for themselves, and be able to make decisions that best meet their needs and wants. A disability doesn't necessarily mean you're not able to do things. It just means that you're able to do things in a slightly different manner.
I first started working with service dogs back in 2007. In 2010, I got my own dog that I was training for me, and my life took a complete turnaround. I got Oren. He was about almost 2 years old when I started training him for me. He's my lifeline. And I don't know what I would do without him.
I have 2 boys with autism, 15 and 22. And I have done advocacy in the community for about 19 years. So we're very grateful that there's a place to be heard and listened to.
So there's the Positive Behaviors, Interventions, and Supports Project, which my daughter, who's 6, is a direct beneficiary of, who goes to one of the schools that are PBIS, where all the students are being taught how to treat others with respect and how to not bully people and how to include children that are different than you. So I love that project. There's also been Employment First. So we started the Employment First Coalition, and because of that, we've had an executive order leading to all these policy changes that are looking at how we can include people with disabilities in our workforce more than we ever have before. We've had things like going out to underserved areas, working with refugees with disabilities and refugee resettlement agencies and connecting them to disability service organizations that they didn't know existed.
Myself and my colleagues got a lot of phone calls and emails and actual parents coming up to us at meetings talking about, my child was a victim of restraint repeatedly in their school. I don't know what to do. My child is so traumatized, I can't even get them in the car in the morning to take them to school. They seem to be suffering from PTSD. What we saw repeatedly were students that were being held down in prone restraints, face down, which are life-threatening. They constrict breathing. A lot of schools, both public and private, were abusing the laws and not reporting to parents and not reporting to the Department of Education on what was happening. A law of the state statute took place to get the law passed on restraint and seclusion in 2015. And it was a battle. The council was very supportive of that legislation. While we can't take exactly a position on an issue, we can educate the public on what the issue is. And the council was very good about showing up at the legislature and making sure that voices were heard. And so when that law in 2015, the actual state statute on restraint and seclusion was passed, it was a huge relief that it was another step in the process of beginning to protect kids. We're not done. We still have a long ways to go.
And I can't leave this conversation without saying that sexual abuse and exploitation of individuals with DD has been one of the top things on everybody's mind because of the work of the council, because of the things that we brought to attention.
And unfortunately, it took a tragedy like Hacienda to bring it to the forefront. It's an issue that impacts a lot of people. Nobody talks about it. We have other agencies on a national level that are now looking at us, and I think we have an opportunity to make public policy change on a national level, not just locally.
In 10 years, this council will be a national leader in developmental disabilities issues, and we will be the council that other councils call.
They're going to be the organization that, whether it's news media or just the general population, goes to for more information, for seeing how they can provide the supports and services for people with disabilities, whether it's through the grants that they fund or the events that they host.
Where do I see the council in 10 years? Well, I don't know. That's a really tough question. So if I were to look 10 years down the road, I would really like to see whoever's in the leadership positions at ADDPC and the Division of Developmental Disabilities and Access, because a lot of the people we serve are on the All-Tix program over in Access, to have them really use the expertise of the council to help them drive their decision making, because that's really the big leverage point and the policy making point. 10 years from now, I'd like to see the council really being an influential catalyst that drives decisions in state government.
In 10 years, I hope that the council is continuing to have a broad impact, not just in Arizona, but all over the United States. I would love to see us continue on in our projects, in particular, educating the media on the proper way to write about and interview people with disabilities, the proper terminology, so that it isn't offensive, it's educational, and it's just people. They just happen to have some different abilities. I hope that we're able to impact policy on a huge scale, particularly for the rights of people with health care and access to the community overall. I think that we will continue on with our current leadership and being able to make some huge changes.
So as opposed to saying to people, I work for the Arizona Developmental Disabilities Planning Council, and people say, what's that? In 10 years, I want to say, I work for the Arizona Developmental Disabilities Planning Council. That is so cool. How, what is it like working there? That's what I want to hear in 10 years, is I want to hear people that know exactly who the Disability Planning Council, the Developmental Disability Planning Council is, and I want them to be not in the disability community. I'll know we're successful when we start reaching our message into the mainstream, because that is true community inclusion, and that's why we're here.